Okay, now we're going to be looking at the spinal column and some of the major parts of the vertebrae. So let's take a look and see. When we look at the spine, here's the posterior view. We can see the spinous processes and the transverse processes. Here's the spinal column from the ventral or anterior view, where it's smoother in the front because we see the vertebral bodies, but you can also see the transverse processes. And from the side view, we can see the cervical curve, the thoracic curve, and the lumbar curve. Remember, there are 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. The cervical vertebrae is called the cervical lordosis, and the lumbar vertebrae is called the lumbar lordosis. Both cervical and lumbar lordosis both arc or curve in the same way. The thoracic curve and the sacral curve are called kyphosis or kyphotic. So many times on X-ray reports or on MRI narratives, we will see the radiologist interpret this as either a hyperlordosis or hypolordosis. If it's a hypolordosis, there's decreased curvature. If there is a let's call it, if it was a hyperlordosis, it's an increased curvature. If it's decreased cervical curve, they call it a hypolordosis or sometimes a military neck. If there's an increased lumbar curve, it's also a hyperlordosis. If it's a sway back, or let's say it's a military lumbar spine, I should say, then we call it a hypolordosis. If we see an increased curvature of the thoracic spine, they call it a hyperkyphosis. Okay. So this curvature here is going to be the cervical curvature, 7 cervical spine, 7 cervical vertebrae. What is the highlighted blue sections from all views, posterior, lateral, and anterior? That would be the TPs, the transverse processes. What section of the spine is this? Cervical is here, thoracic is here, lumbar is here, then you have sacrum and coccyx. So these are the 12 thoracic vertebrae. Notice that each rib articulates to each of its corresponding thoracic vertebrae. So there are 12 pairs of ribs, and they articulate to the 12 thoracic vertebrae. The T1 rib, or the first rib, attaches to T1, and the 12th rib, which is a floating rib, attaches to T12. These are ribs 1 through 12 that is highlighted. Again, these are the ribs that are highlighted here. In this particular case, they're not calling it a rib cage, they're calling it a thoracic cage. Right? The thoracic cage is going to protect your lungs and your heart. This part up here are the 7 cervical vertebrae, so that would be the best answer here. The top vertebrae that articulates with the occipital condyles is known as C1. We don't see C1 as a choice, so we have to choose between atlas or axis. C1 is atlas, C2 is axis. Notice that atlas does not have a spinous process, but C2, 3, 4, 5, 6, and 7 all have spinous processes, and most of them are bifid, right? It's bifid, like it forks, unlike the thoracic vertebrae, which don't have a fork in the road at the spinous. They're not considered bifid. But the cervicals are bifid spinous processes. One of the other things that you can notice is that the transverse processes of the thoracic region, they go up, right? They go upward, up like an airplane, like the wing of an airplane kind of go up a little bit. The transverse processes of the cervicals kind of come straight out, but of the thoracic, they go up. So you have C1, C2, 3, 4, 5, 6, C7. The first thoracic vertebrae, you can see the TPs angle upward. And we can see the first rib articulating with T1, the second rib with T2. The C1 has the widest transverse processes. So now what's highlighted here? Well, this is C2, but we don't see C2 as a choice. We see atlas or axis. So atlas rotates on its axis. So axis is C2. And again, you can see the bifid spinous process here. Let's look at some of the landmarks of typical vertebrae, because C1 and C2 are atypical, meaning they don't have the same usual parts as the rest of the vertebrae. They're a little bit different. But C3 downward are going to have some of the same bony landmarks. Notice C1 has a posterior arch. It doesn't have a spinous process like C2 does. So most vertebrae are going to have a vertebral body. Then posterior to the vertebral body is a pedicle. And then we're going to have transverse processes off to the side. Then there's going to be a lamina and another lamina. When the laminas fuse together, they form a spinous process. So you have vertebral body, pedicle, TPs, transverse process, lamina, spinous process. There are articular facets on top of the vertebrae, and then there are articular facets on the inferior surface of the vertebrae. And a facet is just a smooth surface for another vertebrae to attach or articulate to. So there are going to be superior articulating facets and inferior articulating facets. The direction of the facets indicate the direction that the vertebrae will move. The hole where the spinal cord travels is called the vertebral foramen. This groove right here and this groove right here, when the vertebrae above it articulates, it creates a hole, and that hole is called the intervertebral foramen. So you have a vertebral foramen here, but then an intervertebral foramen, or IVF, where the spinal nerve will exit. So this is the C2 vertebrae. Here's the vertebral body. Here's the odontoid process, or the dens. It's the only vertebra that has that. Here's the transverse process here and here. There's a hole in it called the transverse foramen. That's where the vertebral artery travels through. Here's the spinous process, which is bifid, and just before it is going to be the lamina. So when these laminas fuse, it forms the spinous. If these laminas don't fuse and a spinous doesn't form, they call it spina bifida. So this is the spinous process. Here's the vertebral body. What's posterior to the vertebral body is going to be the pedicles. We can see it both in this view and in the lateral view. Here's the dens, or the odontoid process, but the odontoid comes off the body of the axis. This is C2. We could see right here, C2. This is the body of the axis. Now, this particular portion is a facet. It happens to be the superior articular facets. Here's the vertebral body. Here's the spinous process. Now we have a bunch of facets. Okay, so here is the superior costal facet. Here is the transverse costal facet. And here is the inferior costal facet. So anywhere we see the word costal, this is going to be the pathway for the ribs to articulate with. That's why when someone has a scoliosis or a curvature of the spine, especially of a thoracic spine, we will see the ribs shift and rotate with the spine. So when we have a patient bend down to touch the toe, we call that Adam's test. Adam's test is when we look at not just the spine, but we look at the levelness and evenness of the rib cage. When the spine has an arc or a curvature, the ribs can rotate with it. So superior and inferior costal facet. This facet is on the transverse process, so it's called a transverse costal facet. This right here would be the superior articulating facet, and down here the inferior articulating facet for the vertebrae itself. Here's the TP, or the transverse process. That's from looking at a bird's eye view, superior view, and what it would look like on a lateral view. This is the superior view, so this would be the superior articulating facets. And again, it's a cervical vertebrae because we could see the bifid spinous process. Here's the body, here's the TPs, the transverse process, here's the transverse foramen, here's a lamina, and here's a lamina. Here's the vertebral foramen for the spinal cord. The intervertebral discs would sit right here on the body. So if there's a herniation, the herniation or disc bulge can push back and put pressure on the spinal cord. So if you look here, you can see here is a vertebral body. Here is the bifid spinous process. And then here in the middle is the spinal cord. So if a disc starts to herniate or bulge and it pushes back, it's going to hit the spinal cord. Or it can push and hit a spinal nerve. Okay, so here is the vertebrae, and it protects the spinal cord. Okay, here is the transverse process, but it's pointing to the facet that's on it, so it's the transverse costal facet. It's where the rib would articulate with. Okay, so we'll end this video here, and when we come back, we'll start to look at the upper extremity.